Vermont PBS presents the Governor's Press Conference. Governor Peter Shumlin meets the media to address issues of importance in Vermont.
Hey, thanks. Thank you all for joining us. And I'm delighted to have with me a few folks that we're going to hear from. T.J. Donovan from Chittenden County State's Attorney, and Bob Bick, who's the Executive Director of the Howard Center, working on the front lines of our opiate challenges together. TJ and Bob are with all of us. And I know Mike Layden is here from the Health Department, but you probably are here to help if we get in trouble, Absolutely. Right? Thank you. As you know, we're doing everything that we know how to deal with the opiate addiction challenges, the insidious disease that is affecting too many Vermonters. One of the things that I'm proud that Vermont has done as we've changed attitudes about opiate addiction, as we've changed the stigma about the disease, is to get into our state police and many of our emergency responders naloxone, which is a rescue kit that if you're overdosing from opiates will save your life. So we now have the capacity to quickly save someone who is likely to lose their life from an overdose if you have naloxone or other rescue kits available. We've dispensed almost 1,869 naloxone kits since we vastly expanded the availability of this rescue remedy across the state. I'm proud of the way the state police and emergency responders, fire, others have been on the scene, along with many of our prevention agencies and efforts. And we've literally now, as a result of those efforts, as I mentioned, dispensed 1,869 kits, but we have saved 190 lives that we know about that have been recorded with my Department of Health as a result of getting this simple procedure in folks' pockets so that we can be there when someone's struggling with an overdose. As the New York Times and others have reported, the manufacturer of this drug has increased prices by almost 50% just in the last few months. What it means for Vermont is that 10 doses of naloxone used to cost us $113. That was in early March of this year. And yesterday the price was $183. So from early March to early April, it's gone from $113 to $183 for 10 doses. That's a 62% spike, 62% spike in a little over a month. So as the demand has increased, as smart states like Vermont have said, we're not going to let folks who are suffering from a disease die before our eyes because we don't have the courage to have the rescue kits available. The company CEO has said, great, how can we make some more money on this? And they've drastically increased prices. So I want to thank my opiate addiction task force for joining me in sending a letter to the manufacturer asking them to return to more reasonable pricing.
Has the company offered any reasons why the price has gone up?
They have not. I know that the TJ just mentioned that the Attorney General in New York has negotiated a rebate for New York, but needless to say, there's more and more demand as more and more people, like the Howard Center, like the story you just heard, do the right thing. And my suspicion is that the price increase is a result of capitalist instincts.
So last month it was about $10.30 a dose, and we distributed 1,800 or so, almost 1,900. What is the state's budget? I mean, we're not, when you multiply that out, we're not talking a ton of money here. I mean, if you think about what we pay for alcohol treatment programs, for smoking cessation programs, this is peanuts compared to that. So, I mean,
well, it's not peanuts. And my point is, and I think our concern is, where's the top? If it's gone up 60% in 4 weeks, a little over 4 weeks, you know, one has to ask, where are they going to stop? And The point here is that this gets paid for through a number of sources. And it's not just one budget line item. For instance, the Howard Center finds different ways to make it available to their employees. State police, we use a different budget line item. But collectively, our plan is to get more of this out there, not less of it. And we need a manufacturer who isn't going to try and gouge us.
Has it prevented any doses from being distributed yet at this point?
No. Not that I'm aware of. Not in the state of Vermont. Right?
Correct.
Bob? Yes.
Yeah,
Want to take this?
Well, I would just add one response to that question, and that is that right now, the example you gave speaks to the state's budget, the direct budget expenditure. But last year, the legislature passed a bill to permit pharmacies to actually distribute naloxone without a prescription. And while the system has been working out some mechanisms to deal with that, the hope and expectation is that this medication is going to be available more broadly than just through the state-supported distribution system, which means individuals are going to be able to walk into a pharmacy and buy this medication. So the higher the price point is, the less likely individuals are going to have the resources to buy it. And I think, as we can all expect, the price that the state is getting, even right now with its current price or its inflated price, is probably a wholesale rate. And so when pharmacies put the product on the market, it's going to be marked up to retail. And so the goal is to bring the wholesale price down as much as possible in order to create the greatest access to the medication to the population at large.
Can I ask a question? Is this addressing the global problem of addiction?
No. This is addressing people who are losing their lives once they become addicted, and it's a way to save their lives, get them into treatment, and bring them back to a productive life in Vermont. So this isn't about prevention of using the drugs. We're trying to do other things there. This is about folks who are addicted already and who we've been losing. They've been losing their lives at rates that are, frankly, in this country now, we're losing, I believe, in the United States of America today, we lose as many folks to opiate addiction overdoses as we do to car accidents. In fact, it might be higher. Is that right? Am I wrong about that? It's high.
So are we making inroads on the use issue? I mean, are we seeing a growing problem with addiction, or are we now in decline? We have a lot of work left to do. I'll let Bob, who sees folks every day, deal with that.
I think we have seen some peaking in terms of the number of individuals that are presenting, so it's definitely slowing down a little bit. I think we have not yet reached the bottom, as indicated by the numbers that I referenced earlier in terms of the number of individuals that have made contact with us and the number of folks that we continue to work with in our Safe Recovery program. But we are making progress, and as we continue to get to a place at which we can offer treatment on demand, that's when I think we'll really have been able to say we've crossed a major threshold. Yeah.
And you know, it's worth mentioning that since we took this on, all of us collectively, over a year ago, we have, I believe, changed, as TG gentleman just mentioned, the way that we deal with this disease, from one that we basically averted our eyes to one that we're attacking head on. And you know, we've drastically increased the number of folks in treatment. We still got more work to do. We're working much more collectively on addressing this as a disease, both the prevention end and the treatment end. And you know, I think it's an example of how a small state can really change the way we do things in a very short period of time. The jury's still out on whether we've peaked or whether we've still got more to climb. We're up against the national trends, and I know you've heard me say this before, but you know, we got into this mess because the FDA approved OxyContin about 15 years ago. And when we approved OxyContin, we handed it out with irrational exuberance. We prescribed enough OxyContin in the second year that it was on the market. I read this, but I believe this to be true, to keep everybody high in America over 18 for a month. Everyone high in America over 18 for a month. So, you know, then you see things happen like last year, the FDA approved Zohydro. Now they got this advisory board of docs that tell them, you know, is this drug a good idea or is it not? Zohydro is the next generation of painkiller that's basically OxyContin on steroids. What we learned about OxyContin is make it tamper resistant so you can't shoot it and you can't snort it, you squish it, you crush it and it turns to a gel. We not only approved the next generation of OxyContin on steroids, but it's not tamper resistant. Their own advisory board voted, I believe, 11-3, do not let this stuff on the market. The FDA approves it anyway. And, you know, fortunately, we've been working with the Northeast governors, and thanks to our Vermont's good folks, we're making it very tough to prescribe in Vermont. But, you know, we seem to not get the message as a nation that the more we approve painkillers that we pass out in great quantities to whatever ailments we all have, we're creating a opiate crisis in the country. It's a challenge. It's hard to win the battle when you got folks in Washington working against you.
Governor, last week when you announced, or recently when you announced your contingency plans for Vermont Health Connect, you said that, quote, Optum so far has not only delivered earlier on all the challenges they've been facing and the tech they've been developing, but they've also done it for less money in every case than they've originally outlined. Invoices from Optum to the state covering June to September show that they've completed 5 task orders and that only 2 of those were under budget for a total savings to the state of $14,000 on $2.6 million of spending. I'm wondering if you could just clarify what you meant by that, or if you were aware of that when you made those statements, because it doesn't appear that they have been under budget.
One actually oversees the bills.
Yeah, so this is my fault. Let me clarify, which I tried to do. When I told the governor, this goes back to when we were reviewing whether or not to continue with a time and materials contract with Optum for the remainder of the development. And I focused on the development task orders specifically and asked, how have they done so far? And was given a list of task orders that had been through vendor management review, so pre-invoice, and looked at them, and these were development task orders specifically, and was told that here is, based on our review of deliverables and what's been submitted, a track record. So it was specific to, in my mind, to deliverables, the question that I was being asked. The June, July, or a few task orders that there were 2 in the review stuff that I think were dead even, and those were associated with the original review pieces that we hired them for. And then there were a couple with the staff augmentation that were actually over target. So that's me misspeaking to the governor, being focused on the development task orders and not including, in my mind, the operations ones, because of the question that I was trying to solve for, whether or not we should continue with the time and materials contract or try to go to fixed price and evaluating the relative risk. So I take responsibility for that.
Information you gave him?
Yes, my responsibility.
Okay, you guys had said at the time that a lot of your confidence that Optum's going to deliver at the end of May, it was based on the fact that they've been able to work on time and under budget. And I
go back to the vendor reviews of those deliverables-related, development-related task orders, excluding the operation task orders, and it has been consistent since then. And in the intervening period, the things that we expected in order to be able to meet the May 30th deadline have happened on time as expected. The renewals contract, for example, has been submitted to CMS for review. The requirements traceability matrix and the other things that are required to be on track for May 30th have been completed on time by Optum. This isn't to say it isn't still a high-risk project. You know, this is a tight timeline with a lot of work yet to go, but the health check, if you will, is that things are proceeding as one would want them to come in on time.
Governor, I believe you recently told Neil that the current version of House health care bill is minuscule, I think was the word you used. Do you still think it's worth, do you think it's worth passing in its current form?
You know, I think we have to ask ourselves what we're trying to do with health care. And let's just go back to the basics for a second. What I focus on every day is how do I make Vermont's economy work for every single Vermonter at a time when the middle class is getting kicked in the teeth, where low-income Vermonters are losing ground. And there's just no doubt in my mind that there are two things that are holding back Vermonters' incomes right now. One is school spending that rises faster than we can make the money to pay for it. And the other is healthcare costs that climb faster than we can earn the loot to put in our pockets to pay for it. And anyone who's paying private insurance premiums gets that when they see them go up 6, 10, 12, 18, state of Vermont's went up 18% this year, so taxpayers are paying for that. You know, that's not sustainable. So I went out with a plan to help us solve three problems. One, if you're on Medicaid, and we've been speaking of the Affordable Care Act, I know we like to get into the details of the website, but we've been successful in cutting our uninsured rate in half in this state, almost half. That's a big deal. We're competing with Massachusetts for the lowest uninsured rate in America. We're down to 3.5% uninsured. That's almost universal coverage. We've done that by signing a lot of folks up for Medicaid. So we've got more and more Vermonters who have a card, they finally have insurance. They call up their provider and they say, I've got insurance. Can you check me out? I need a checkup, or I got an earache. And they say, well, we can't take too many people with your card because we get paid 40, 60 cents on the dollar for the work we do to you, and we'll go bankrupt. So the answer is no, we can't help you. Try to find another provider. So low-income Vermonters who can't get access to care. Raise your hand if that's not a problem. Second, we've got providers who desperately want to provide health care to people, make them better. That's what they got trained to do, doctors, nurses, chiropractors, you name it. Sure, come on in. And, and they literally can't stay in business. They can't pay their bills. And third and finally, businesses are paying for this, and people who pay for private insurance with these increases that are holding back our incomes and making Vermont less affordable. So my plan was to draw down the $110 million we're leaving on the table of federal government to help meet some of the challenges the House Health Care Committee very smartly addressed and did it very adequately, and do something about the cost shift that Republicans, Democrats, independents, progs all seem to agree is a problem. So my point is, let's remember what we were trying to do. What I was trying to do was solve this problem that no politicians have yet had the courage to solve. And I think we should solve it.
So the question was, do you support the bill?
Excuse me?
The question that I asked was, do you think the bill is worth passing in its present form?
I think that I'm going to wait to comment on whatever health care bill ends up on my desk. But I would very much like us to refocus on what I think we all agree the problem is, which is a cost shift reimbursement issue that's hurting low-income Vermonters, hurting our providers, particularly rural, small docs, nurses, and others, and making it very difficult to create jobs in the state because health insurance gobbles up more and more of our incomes.
This weekend there's going to be lots of state workers rallying about job cuts, perceived job cuts. What's your message to them when they say that broken campaign promises?
Well, first of all, that's simply not true. Let's just do the facts here for a second. When I came on, the state employees had had 2 consecutive years of 3% pay cuts. I'm not talking about lack of increase, but actual reductions in pay. Those were implemented by the last governor when we were in tough fiscal times. So they came to the table, and that's what they all agreed they'd take, and they did. The question for me as a candidate is, Governor, are you going to make us continue to have 3% cuts, or are you going to fight that being restored? And I said, no, I'm going to restore it. Secondly, we've negotiated 2 consecutive contracts without ever going to binding arbitration. Working together, had a very good relationship. There has not been a governor who's faced budget challenges, mine's $112 million, who hasn't asked the workforce to all come together, including folks like me, and say, hey, we're going to put some skin in the game here. We got to help solve this problem. Now, the legislature just agreed with me in their budget by saying you got to find about $11 million, $10.8 million in savings from state employees in order to hit this $112 million problem. And listen, this is what I know Vermonters don't expect. They don't expect us to turn to them and say, we've got budget problems. We know you've got a lot of extra money in your pockets, so we're just going to tax you and solve all our problems. They expect us to find efficiencies, which my budget did, $15.5 million of ongoing efficiencies, to make real cost reductions, not cuts. People use the word cuts in this building. These are reductions over what the increase otherwise would have been. And to have the state employees contribute, as they always have, under Governors Snelling, Dean, and Douglas in tough times, to the solution. And my question is, what is so different about my administration? If you came to the table in the right way for the best of Vermont and the best of your jobs, good, hardworking state workforce, in all of the other crises that we've hit, why am I special?
Revenues. House Republicans have said that when the contract was approved by your administration, that that it was unrealistic to begin with. Could you comment on that? Do you think that the contract that you agreed to was realistic at the time, given what you knew about the revenues?
Well, I think we held them to 2.5% increases, as you know, 2 consecutive years. So, if they could have negotiated a better deal, I'd have brought them to the table with me. But the bottom line is, I don't quite understand what they mean. We worked very hard to negotiate contracts that were both prudent and fair, and I think we did. Now we have a deficit, or not a deficit, but a budget challenge that we need some help with. And as Governor Snelling, Governor Dean, and Governor Douglas found when they were also in this position, we could use some help. We're going to get the help. And the bottom line is, the legislature got it right. We're going to get $10.8 million worth of savings. There's 2 ways we can do this. We can do this the blunt way, which is lay off a lot of state workers and get $10.8 million worth of savings. Or we can do this the smart way. Sit around the table collectively and figure out a really constructive way to do this that does the least harm to state government, to the state workforce. So, we shouldn't be fighting about this. We should be sitting down and figuring it out together.
Governor, in January you outlined banning teacher strikes as one of your priorities. And with the House talking about that today, why haven't you been more involved in this discussion? It was one of your priorities, yet we haven't heard you talk about it. We haven't heard that you're lobbying lawmakers as far as the NEA and others are. So was it really a priority?
Well, as I've often said, I've been consistent on this one for as long as I think I've been in public life. When asked, and I was asked during this campaign when the South Burlington folks were on strike, I believe that strikes hurt kids, they hurt parents, they hurt communities, and they hurt teachers. And I can tell you, fortunately they don't happen all that often in Vermont, but when they do, they're really, really damaging. And I can take you to communities now where they had a strike 10 years ago, and there's still hard feelings among the people that were involved in those battles. So there's a reason why the states around us, also very similar with values and educational goals, don't allow strikes. So what I've said is I promoted, I mentioned it in my State of the State, or my inaugural address, or I guess my budget address, but I support a fair bill that, where the teachers give up the right to strike, and where the management gives up the right to impose a contract, and we find the right balance so that we can do what the state employees do. The state employees can't strike. They've got a process. So I support it. I hope they pass a smart bill. It's got to be the right bill.
Can you talk a bit about the income tax deductions and the ability of people who do take all these deductions, the limits on those in the House bill? Are you in favor of those?
Well, I'm in favor of the provision that I put forward in my budget, which I think is sensible. Basically what it says is, what I said is I want to raise $15 million towards a $112 million budget challenge. We all agree the tax box is somewhere around 30, 32 million. By finishing the job of taking away the ability to deduct last year's taxes from this year's taxes. And I took that one in terms of an adjustment because it doesn't provide any altruistic purpose. It's not trying to, we use tax policy for 2 reasons. One, obviously to raise revenue, but the other is to direct behavior. I have real concerns about the deductions that they've chosen because it says to middle-class Vermonters, and it particularly hits seniors particularly hard, you know, charitable deductions, we'd be pretty lost in this state without a robust charitable donors supporting all the things that make the state great. We'd be pretty lost in the state without the home mortgage deduction where we promote home ownership. And we'd be struggling, in my view, if we said to particularly seniors, when you have catastrophic medical bills that your policy doesn't cover, we're not going to help you. So we did those three things for three very specific reasons. They affect middle-class Vermonters who are struggling right now, and I'd encourage us to be very prudent about taking them away, particularly at a time when the middle class is hurting more than ever.
Why do you think we'll need the sugar-sweetened beverage tax to balance the budget?
Well, I don't believe we'll need the sugar-sweetened beverage tax to balance anything.
Well, you said that.
No, what I said was that I think we should be careful. The beauty of my solution to health care was that it came up with a dedicated revenue source that we don't use for any other purpose, a payroll tax, which I believe we can get back to the people who pay it, who are buying insurance, with a reduction in rates that they're otherwise going to pay. Any expansion of the sales tax or any of the ideas that have come along are traditionally revenues that we've used to balance the general fund. And since we haven't agreed on how we're going to raise the $32 million that we all agree we need for the $112 million problem, I would argue, let's not use money that we have traditionally used, sales tax and others, although I don't like the sales tax, but let's not use money that we've traditionally used to support the general fund when we're trying to do something entirely new and different for healthcare. Let's use a dedicated source of revenue that will be there for that purpose, and I identified that as the payroll tax.
There's no sweetened beverage tax currently. That's a new source of revenue that will be dedicated to healthcare. Do you support that?
I just don't think that a sugar-sweetened beverage tax is going to come to my desk. So I've got to look ahead. I've got to look at when we're sitting around this table in May, what do I have to deal with? I don't predict that sugar-sweetened beverage will be on my desk. Any other questions? Thank you for joining us.
Watch the Governor's Press Conference each week at this time here on Vermont PBS World. You can also log on and see previous press conferences at our website, vermontpbs.org.